Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Boulder, Colorado, and I offer a Skype therapy service for providing help in overcoming anxiety and also for work with depression and addictions and many other common psychological problems that can benefit from the techniques of mindfulness therapy. So I specialize in mindfulness therapy for treating anxiety and for help with depression and addictions because mindfulness therapy is, in my opinion, one of the most effective ways of really transforming the underlying cause of your emotional suffering. So we need to work on the underlying psychological habits that are operating, that work out of consciousness to create your anxiety or depression. Medications will not do that. So medications is not really a suitable treatment for anxiety or depression because it doesn't get to the root cause. It only masks the symptoms of anxiety or depression. And that can be really problematic because if you leave the root cause unaddressed, then it could get considerably worse over time and could lead to significant psychological problems. So it's best to get to grip with the underlying habits that cause your anxiety or depression as soon as you can. Do not leave them unattended. Do not try to mask them with medications or any other avoidance technique. We must address the underlying cause. So in mindfulness therapy, which is what I will teach you during these Skype therapy sessions, we do this by changing the way that we relate to our emotions and to our thoughts and to our beliefs and also memories. The biggest problem for most people is that they do not have a conscious relationship with their mind. They simply have a unconscious reactive relationship with their mind. That means that whenever an unpleasant emotion is triggered, we react with avoidance or with hatred, or we become lost in that emotion or train of reactive thoughts. So reactivity is the real problem, much more so than the underlying emotions or thoughts themselves. It's the reactivity that stops those underlying emotions from healing. So in mindfulness therapy, we bring a great deal of consciousness to our emotions and to the reactive habits that feed those emotions. We do this by actually learning how to meditate on the mind, how to meditate on our emotions, our thoughts, our memories, and our beliefs. This means that we learn how to develop an objective relationship with the content of mind, whether that's thoughts or memories or emotions. We learn to become the observer, seeing the content of mind, but not reacting to them. And this is a training process. This is something that you are well advised to train in, and mindfulness meditation is a training in how to be with thoughts and emotions and traumatic memories without reacting, without becoming consumed by them, without becoming overwhelmed by the emotional suffering associated with your anxiety or depression. Because if you become overwhelmed, that is a form of emotional reactivity, and that will simply reinforce the underlying emotions. If you react with rumination or overthinking, that will also feed the underlying unresolved emotions, the anxiety or depression. If you identify with beliefs about yourself, those negative beliefs will reinforce the underlying emotions. So the secret for real change is to totally transform the relationship that you have with the mind. You have to be able to learn how to hold all of these mental objects in the mind without identifying and without reacting. Then you stop feeding the underlying emotional pain. When you stop feeding it, it can begin to heal. And in fact, it is already trying to heal. That's another very important thing to understand. Anxiety, depression, whatever it might be, guilt, grief, or emotional trauma, these are all what we describe as being very unstable energetic states. And nature does not like unstable energetic states. It will always move in a direction of decreasing that instability and returning to a state of balance. We see this in nature, we see this in the body. It's what we call homeostasis. We see this in the mind as well. So if you're suffering from anxiety or depression or grief or anger or whatever it might be, rest assured those emotional states are already trying to heal themselves. And the only reason they don't heal is because of reactivity. So that's one of the principles that we cultivate during mindfulness therapy. And I will teach you how to do this. I will teach you how to meditate on your emotions so that you can develop this different non-reactive relationship. Now, when you have a non-reactive relationship that does not feed the underlying suffering, then you can begin to explore the structure of your emotions and how to help them heal. They are already trying to heal, but we can speed up that process considerably by bringing in the consciousness element that is mindfulness. We can begin to investigate the structure of the emotions. We can look at the reactive thoughts, and we can change those reactive thoughts so they don't feed the emotions. But we can also look at the imagery of the emotions. That's a very important theme. Not many therapists understand the importance of emotional imagery. So emotions are structured around imagery. How you see the emotion in the mind is what actually sustains that anxiety or depression or grief or trauma. Think about PTSD and flashbacks. Those very traumatic images are what actually trigger the emotional trauma. And then we can get into reactive patterns of reacting to that trauma with guilt or shame or anger or addiction or any number of different secondary reactions. But the primary cause of the trauma is the imagery. So when we can investigate that imagery, we can then begin to explore changing it. And when you change the imagery of an emotion, you help it release its energy. It becomes less intense. It begins to heal. That is what happens when an emotion heals. It releases its energy, and that energy becomes reabsorbed in the mind and the psyche. So we work on fundamentally changing and transforming the relationship that we have to our thoughts, our emotions, our beliefs, and our memories. We then start to investigate the imagery of our thoughts, our emotions, our memories, and our beliefs. And we explore mindfully how to facilitate healing by helping that imagery change. So these are some of the things that I will teach you so that you can apply mindfulness and mindfulness meditation to continuate the natural process of healing your anxiety or depression or any other form of emotional suffering that has become stuck. So if you'd like to learn more about the mindfulness-based approach to psychotherapy, and you would like to learn more about this Skype therapy service that I provide, then please contact me and feel free to ask any questions you may have. And let's schedule a trial session so you can begin to explore for yourself just how effective mindfulness therapy is for healing emotional suffering. Thank you.